thank you very much for inviting me to this outstanding conference, and let me confess to you that as a clinician, nanomedicine is one of the biggest mysteries, but I hope to be able to guide you through some problems in rheumatology, which we divide into two big groups, being the degenerative problems and the inflammatory problems, with, in the degenerative field, maybe osteoarthritis being one of the biggest problems. Within the inflammatory group, we further distinguish bacterial infections, as well as autoimmune problems and autoinflammatory problems, which is newly distinguished in order to stress the fact that mechanisms involving the innate immune system are more prominent in the autoinflammatory disorders, whereas in autoimmunity it's more the acquired immune system. And there are some diseases that fit less well into either category, and I will present you also shortly some of these diseases. Let's quickly stay in osteoarthritis, which we all know has some risk factors, aging, for example, and the presence of some rare mutations in genes, for example, in collagen type 1 and so on, but more recently also inflammation has been demonstrated to be an important driver of some of the cartilage degradation and bone resorption taking place in osteoarthritis. Another interesting thing has been discovered by two independent researcher groups which have actually fabricated mice that lack the proofreading component of the enzyme that normally replicates mitochondrial DNA, so that the mice do acquire at lifetime, do somatically acquire at lifetime mutations in mitochondrial DNA. And you can see here the phenotype to the right, the mutant mice, whereas the age-matched wild-type mice are to the left. The mutant mice, they age prematurely. They not only have a gray skin and acquired bone deformities, but they also have premature death, pointing out that mitochondria actually have an important mechanism in degenerative diseases. And you will see throughout the talk that I'm trying to make a link between many problems in rheumatology and mitochondria as a potential target for nanomedicine. The other disease, or the prototypic disease for the autoinflammation, actually has already been named. It's gout. It is a disease that has been on this planet for quite some time. Probably also already dinosaurs suffered from gout. It is a disease that starts extremely rapidly, not only with signs of local inflammation, but also with quite severe signs at times of systemic inflammation involving fever, for example. And the mystery is also still why the disease is self-limiting after usually a few days. We've already heard that the gout involves the activation of interleukin-1 beta in monocytes or macrophages, which then gets liberated and then recruits neutrophils in the inflamed joint. And of course, it's the inflammasome that converts inactive interleukin-1 beta to the active form. What exactly triggers the activation of inflammasomes, to my knowledge, is still a mystery. We know from the Lausanne laboratories that mitochondria are probably also involved, especially in a respiratory chain-dependent fashion. Reactive oxygen species are formed and contribute to inflammasome activation. However, the mechanism by which mitochondria actually do sense the presence of monosodium urate crystals in the monocyte or macrophage, to my knowledge, has not been well delineated. Here you see a short list of many other conditions in rheumatology thought to be autoinflammatory because they are associated with known mutations of components of the inflammasome. These are usually diseases associated with fever, as well as some rare granulomatous diseases. There is a longer list, and which also involves more frequent diseases For example, Behçet's disease is one of them. One disorder that is less clear-cut or can be less clear-cut distinguished or attributed to one of the autoinflammatory or autoimmune groups is systemic sclerosis. It is a disease that usually starts with a Raynaud's phenomenon, and then leads to the deposition of collagen in the skin, but also in the internal organs, which then lead to life-threatening complications and to a severely increased mortality. There's also another disease component leading to the obstruction of the vessels. So we have the factors inflammation, obliterative vasculopathy, and fibrosis driving the disease in systemic sclerosis. And again, what really initiates this problem has not been understood. We have only very little indicators from epidemiological studies, and we also do not know what perpetuates the disease. And again, reactive oxygen species, possibly liberated in the mitochondria, participate in maintaining the disease activity, and through a variety of mechanisms feed into the fibrotic process that we find in this disorder. Lastly, let me point out another rheumatological disease. It's called Wegener's granulomatosis. It's a small vessel vasculitis associated with the presence of certain autoantibodies in the patient's sera. These autoantibodies are directed against components of the cytoplasm of neutrophils. This disease usually starts in the nose or other organs of the head, and then may involve either the skin or, in a life-threatening way, also internal organs such as the lung and the kidney. And interestingly now, two factors associated with disease relapses, namely the presence of Staph aureus in the patient's nasal epithelium and the presence of high titers of these antibodies in patient's serum, have been shown to prime neutrophils to release chromatin into the extracellular space. This chromatin actually may consist of mitochondrial DNA, and it forms web-like structures and therefore is called neutrophil extracellular traps or nets. And now, even more interestingly, these nets were shown to contribute to endothelial cell injury, and conversely, such endothelial cell injury again is able to promote the formation of these nets. In other words, it's closing a vicious circle that may perpetuate the disease process by delivering danger-associated molecular patterns, namely mitochondrial DNA and others, to the toll-like receptors of the innate immune system. And one has found these nets in vivo in the affected organs of these patients with this type of small vessel vasculitis. Another superimposed process in vasculitides, but also in other diseases with obstructive vasculopathies, for example, systemic sclerosis, is of course tissue hypoxia, which is sensed through the hypoxia-inducible factor, and which also probably is pro-inflammatory by activating NF-kappa B dependent pathways. And again, there's many factors leading to the activation of hypoxia-inducible factors. Amongst these are reactive oxygen species and hypoxia, and there's also a role for mitochondria at play in liberating oxygen radicals or in regulating tissue hypoxia. So if we now come to the first slide, we have those different groups of rheumatological problems. We may add fibrosis as a fourth problem, and we could place mitochondria as a switch in the center that, through a variety of mechanisms and still mysterical reasons, participate in aging, autoimmune processes by regulating apoptosis, providing danger signals leading to the promotion of autoinflammatory processes, and through other mechanisms also participate in tissue fibrosis. I'm telling you this because I could envision that if one better understood this mystery, one could use mitochondria as a target for nanopharmaceuticals. I'm interested in your opinion, and already a couple of vehicles targeting these nano drugs have been devised. Thank you.